There are 5 health checkups you should reconsider after turning 70. Ones that could do more harm than good. It's a truth that most seniors never hear from their doctors. Every year, millions of older adults get routine checkups, thinking they're protecting their health. But what if I told you that some of these tests, prescribed regularly by your doctor, could actually increase your risk of surgery, stroke, or even cancer? Recent studies show that up to 37% of medical tests for seniors result in unnecessary treatments, complications, or lifelong side effects. Shockingly, 99% of individuals over 70 remain unaware that they're being over-tested. One of these checkups, the first on our list, is responsible for 5% of all cancer cases in the United States, equivalent to the number of cancer cases linked to daily alcohol consumption. You won't hear this from your healthcare provider, and you won't find it advertised anywhere, but it's hidden in the research. Today, we're exposing this truth. In this video, we'll discuss the 5 health checkups you should avoid after 70 and the alarming consequences they can have on your body. All of this is supported by real science, and you won't believe which test made it to number 2. Before we dive in, tell us in the comments below where you're tuning in from, your age, and if you've ever regretted a medical test or procedure. Do you think seniors are over-tested? We're reading and responding to every comment with tailored advice. And don't forget to like and subscribe for more insightful content like this. Now let's jump into the first test, one that seems harmless but could silently diminish your quality of life.
Number 5, bone density scan. It may seem harmless, a quick scan with no pain or needles, and you walk out knowing if your bones are at risk for fractures. But here's what they don't tell you. After the age of 70, a bone density scan can create more fear than it provides benefits. This scan, known as a DEXA scan, measures the strength of your bones, and is primarily used to detect osteoporosis. However, for older adults, especially women, the results often show lower bone density even when there's no real danger. Bone loss is a natural part of aging, just like wrinkles or gray hair. It happens to everyone. But many seniors are pushed into medications like bisphosphonates, designed to strengthen bones. But they come with serious side effects like jaw necrosis, where the jawbone starts to die, and esophageal irritation. Here's the problem. Studies have shown that treating mild bone loss in people over 70 with medication has little to no effect on actual fracture rates. A study published in the American Geriatric Society Journal followed over 1,200 women over the age of 70 and found that bisphosphonates reduced fracture risk by only 0.3% after 5 years. It's a small number, but it's far from life-saving. Instead, those women were far more likely to suffer from side effects of the medication, including digestive issues, inflammation of the esophagus, and brittle bones that break in strange ways. Let me share the story of Rose, a 76-year-old retired piano teacher who was referred for a DEXA scan after her annual checkup. She had never fallen, felt any pain, and walked daily. Her scan showed osteopenia, a mild reduction in bone density, not osteoporosis. Her doctor immediately started her on bisphosphonates. 3 months later, she developed severe reflux and jaw pain. By the time we saw her, she hadn't played the piano in weeks. We took her off the medication and put her on a regimen of vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet with sardines and leafy greens. A year later, she was back to playing piano with stronger legs, better balance, and no fractures. A quick scan may seem like a good idea, but for people over 70 who aren't falling or breaking bones, the better option is lifestyle. Strength training, balance exercises, proper nutrition, and treating vitamin D deficiency have been shown to reduce fractures by more than 20%, according to a 2022 Osteoporosis International study. Don't let a number on a screen push you into treatment you don't need. However, there's one scan that can lead to something even scarier: brain surgery. Next up, number 4, brain MRI for memory loss. When seniors feel more forgetful or confused, the natural impulse is fear. Fear of dementia. Fear of Alzheimer's. In response, doctors often order a brain MRI. But here's an inconvenient truth. MRI's detailed scans showing the brain structure rarely offer the answers patients hope for. Actually, in most cases, MRIs in individuals over 70 simply show typical age-related changes, such as slight shrinkage or white matter spots, which are entirely normal in older adults. But here's the problem. These spots, once detected, can trigger a wave of fear, leading to more tests and potentially even surgery. Surgery that may not improve memory and could make things worse. A 2021 study published in Neurology Today analyzed over 3 Zero MRI scans of patients aged 70 to 85 who had mild cognitive complaints. 86% of the scans showed some kind of abnormality, but only 3% were linked to treatable conditions. This means 97% of people were subjected to unnecessary stress and concern, thinking something was wrong when nothing significant was found. Even worse, almost 12% underwent invasive procedures such as spinal taps or biopsies based on vague MRI results. Take George, a 74-year-old retired engineer. He was concerned about his forgetfulness. While sharp, he occasionally misplaced his keys and forgot names. His doctor sent him for an MRI, which showed changes in his white matter. George panicked, fearing dementia, and even stopped driving and attending church. Over the following months, his anxiety increased. But after a standard cognitive test, we found that his results were well within the normal range. We reassured him that the MRI results were age-related and not alarming. We also encouraged him to focus on lifestyle changes, like improving his sleep, hydration, and mental exercises. In just 3 months, George's memory stabilized, and he regained his confidence. The reality is, unless neurological symptoms like seizures, sudden personality changes, or rapid functional decline occur, an MRI is seldom helpful for mild memory loss. A much more effective first step is a simple cognitive screening test, which assesses memory, attention, and problem-solving abilities. It's inexpensive, effective, and helps avoid unnecessary panic. Get ready, because the upcoming test is one that you've most likely encountered before. There's a reason it's number 3 on the list: the cardiac stress test. This is one of the most common tests prescribed for elderly individuals who report mild fatigue, chest discomfort, or simply not feeling as they once did. The cardiac stress test is a procedure where your heart is monitored while you walk on a treadmill or are given medication that mimics physical exercise, designed to detect blockages in the arteries. However, after the age of 70, this test often proves more harmful than beneficial, especially when conducted on individuals without clear signs of heart disease. This is because the test can result in false positives, leading to unnecessary heart procedures that come with serious risks. The issue lies in the accuracy of the test. Research indicates that for adults over 70, the false positive rate, where the test shows a problem that doesn't exist, can be as high as 40%. This often leads to follow-up tests such as angiograms, and in some cases, unnecessary procedures like stent placements or bypass surgeries. A significant study in 2017 published in JAMA Cardiology found that over half of the stents placed following stress test referrals were done in patients who exhibited no real symptoms or received no benefit. Moreover, these patients showed no improvement in survival rates or quality of life after undergoing the procedure. However, what they did experience were higher rates of bleeding, kidney damage from contrast dyes, and extended hospital stays. This was the case for Raymond, a 75-year-old retired postman who kept active by walking daily. During a routine checkup, he mentioned feeling fatigued when walking uphill. His doctor decided to schedule a stress test to rule out any underlying issues. The results were unclear, leading to further tests and an eventual stent placement. Unfortunately, Raymond suffered a reaction to the contrast dye,
leading to kidney issues and a prolonged hospital stay. In the end, his fatigue remained unchanged, as the real issue wasn't related to his heart, but simply a need for better hydration and rest. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity, shortness of breath on exertion, or a significant drop in energy during light exercise, then a stress test may do more harm than good. A better option is often a resting EKG, which is a test that looks at the heart's rhythm while you're still, or even a coronary calcium scan, which is a low radiation imaging test that shows whether dangerous plaque is building up. These are safer, simpler, and far less likely to push you into a procedure you didn't need. Second on the list is the colonoscopy. This might catch you by surprise, but colonoscopy, a procedure that involves using a long camera to check the colon, is not always a good choice after 70 and almost never recommended after 75 unless there are clear symptoms. As people age, the risks associated with the procedure increase. The preparation process is harsh, involving strong laxatives that may lead to dehydration, dizziness, or kidney problems. Additionally, the sedation used during the procedure adds risks to brain function in older individuals. Perhaps most surprisingly, the test itself can lead to complications such as bleeding, tearing, or even disturbances in heart rhythm during sedation. A 2019 study published in Annals of Internal Medicine followed over 1.3 million Medicare patients aged 70 and above. The study found that for every 1 colonoscopies conducted on patients older than 75, only 2 lives were saved, while more than 20 people experienced serious complications. This presents a 10-to-1 risk-to-benefit ratio. Even when polyps are detected, many are small and grow slowly. In older adults, removing them may sometimes cause more harm than leaving them untreated. Dana, a 73-year-old grandmother, ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in bowel movements, and no family history of colon cancer. However, her new primary doctor, fresh out of residency, recommended she undergo a screening colonoscopy. She agreed to the procedure. During the colonoscopy, a small polyp was removed, and she was sent home. However, that night, she experienced severe abdominal pain and fainted. At the hospital, they discovered a bowel perforation. She spent 9 days recovering, lost 10 pounds, and hasn't been the same since. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a stool-based test like the FIT test, which is a non-invasive fecal test done at home, is often a safer option. It has no prep, no sedation, and still catches most concerning cases. Ask your doctor about alternatives, because once you're in the colonoscopy pipeline, it's hard to get out.
Now we come to the most overused, most dangerous, and most harmful checkup for seniors, and it's likely you've already undergone it. First on the list, annual full-body CT scans. These scans, often marketed as part of executive health packages or preventive services in private clinics, are promoted as a method to detect cancer at an early stage. But here's the shocking reality. These scans expose your body to a significant amount of ionizing radiation. For older adults, particularly those over 70, the likelihood of triggering unnecessary follow-ups, biopsies, and even surgeries is extremely high. The irony is that there is absolutely no evidence showing that full-body scans without symptoms actually save lives. Each scan exposes you to between 10 to 20 millisieverts of radiation, equivalent to approximately 500 chest X-rays. A 2023 modeling study published in Annals of Internal Medicine suggests that the increasing use of CT scans in the United States may now be responsible for up to 5% of all cancers, placing them alongside alcohol as a cancer-causing agent. This means that 1 out of every 20 cancers could be triggered by a scan that was intended to prevent disease. This is not only counterproductive, it's downright terrifying. The scan may detect harmless nodules, calcifications, or cysts that are merely a natural part of aging. However, once they are detected, a red flag is raised. This leads to more scans, followed by biopsies, and then panic. Let me tell you about Marcus, an 80-year-old active man who once taught martial arts to younger seniors. He felt great and participated in a senior elite checkup at a private clinic. His full-body scan showed a tiny 3 mm long nodule that set off a chain reaction. He was referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy. The result was benign, but the biopsy collapsed part of his lung, leading to hospitalization and a 2-month recovery, all for something that could have been left alone. Experts now recommend that full-body CT scans should never be used for routine screening in asymptomatic adults. The American College of Radiology is clear. There's no proven benefit and considerable potential for harm. If symptoms such as unexplained weight loss, coughing up blood, or visible swelling are present, then targeted imaging is appropriate. Scanning the entire body with no clear focus is like searching for treasure with a landmine detector. You may find something, but the potential damage could be far worse than the issue you're trying to avoid. A safer and smarter approach is to listen to your body. If you feel healthy, keep up with regular checkups with your primary care physician and only undergo tests that are clearly warranted. Your time, energy, and health are far too precious to be wasted on fear-driven screenings that may leave you in worse shape than when you began. So, there you have it. 5 checkups that may appear helpful but can actually cause harm, especially after the age of 70. Modern medicine is powerful, but it's not without flaws. Sometimes less is more. Always ask, what happens next? If a test reveals something, if the results are unclear, or if the risks outweigh the benefits, it might be time to take a step back. And always remember, true prevention begins with lifestyle. Stay active, eat well, sleep deeply, and make sure to choose your checkups wisely. Now, we want to hear from you. Have you or someone you care about ever experienced complications from a medical test or treatment that turned out to be unnecessary? What happened? Please share your experiences and thoughts with us in the comments below. We'd love to hear from you. Thank you for watching.